Behind every number is a real child, a real family. Their stories are as important as any statistic.
I am 31 years old and married. We have one son and another boy on the way. I went to The Ohio State University for my undergrad. I went to San Diego State University for my master's, and I'm at Texas Tech University for my PhD. During my pregnancy, I was told I was high risk. There was trouble getting into mental health experts as well as some other experts. My healthcare providers were at a university hospital, and they would put me on the high risk, urgent need to be seen. Because of the COVID situation, I could not be seen. I've had long-term anxiety issues, but it got worse during the pregnancy. When someone tells you you could have a stillborn baby, like, you don't really hear anything they say afterwards. I reached out to Moms to Be. They reached out to the hospital, and within less than a week, I was seeing the experts that I needed to see. I got through my pregnancy, the Noche was born, and he was 3 pounds, 14 ounces. He was rushed to the NICU. Worst feeling you get when you're a parent and your child has to stay in the NICU. But your child is also going to need services afterward, and you're told that because you have private health insurance that you can't have an advocate at Children's Hospital. So we had to go through our health insurance to get an advocate. The advocate knows about programs within Children's that we might not know about, but our health insurance, they said it nicely, but pretty much the cheapest healthcare services possible for him. If I hadn't advocated for him, I'm not sure he would have gotten access to help me grow early intervention. When he was reevaluated in person, they realized he had a problem with feeding, that he had bad torticollis and he needed PT and OT, that he had a problem with his eyes and fine and gross motor skills. My husband and I have talked about and have discuss how fortunate and blessed we are that we have the education level and the financial ability that we do to help our child. We can't even imagine how it would be if we didn't have the resources or have the education to know that we can appeal. My son's doing great, but that's because we have been able to get him resources with Help Me Grow Early Intervention, as well as with our local children's hospitals. He would not be where he is today, which is at 18 months being able to walk properly. When individuals look at him, see a healthy 18-month-old. If it weren't for programs like Help Me Grow Early Intervention, down the road, it would cost the state more money to help fix the problem. We wait for pretty much every service. Feeding therapy, physical therapy was a little bit less of a wait. Speech therapy has been a wait. If I were to work, then the therapy hours that were available get shorter and his therapy wait lists get longer. And some therapies he wouldn't be able to attend because they're only available during certain hours. If it's so hard for them to get, for my child to get early intervention services, like how hard will it be if they were to need IEP services or something like that?